Yes,
Sir.
sir.
Good. Okay, so task-based learning. Generally, we use the term PBL, but it can mean so many things, like team-based learning, can be task-based learning. So that's why I decided to use the abbreviation of task-based learning different than TBL. It can also mean technology-based learning or theme-based learning. So to make sure that we don't confuse between different terminology, so we will be using the term TSK or task-based learning in our session. All right, so the learning outcomes this session, we explain the concept of task-based learning, compare the task-based learning with other methods like PBL, team-based learning, and case-based learning, and conduct the task-based learning sessions. And the participant would be able to implement the task-based learning approaches in their institutions. So little bit of history in introduction. It was introduced in 1988 by Professor Harden, who made a presentation in the Association of Study of Medical Education in Bristol, and was reported in 1989. The reference is there. So in PBL session, a small group tackles a paper simulation, whereas in task-based learning, the focus for learner is not a paper simulation, but a real or actual task, commonly addressed by the health care professionals. Right? So that is the first thing which we should be very clear. Although the approach is like PBL,
Same.
yeah, basically it is a PBL. I'll show you how. But in this case, it is not a paper problem. It's not a scenario. It's not a trigger. It is an actual task. The important thing is that this task should be one which is commonly addressed by healthcare professionals, right? So, okay, so please mute yourself. Right. So in the major difference between PBL and task-based learning is that in PBL, we use a paper problem, whereas in task-based learning, it is an actual task. But important thing is that task should be commonly addressed by health professionals. It might be, for example, measurement of blood pressure or taking history of a patient with pain in abdomen or prescribing an antibiotic for a patient with a chest infection. So tasks would be like that. It can be a procedure like measurement of blood pressure, or it can be in history taking or writing a prescription. So these are the tasks which are commonly faced by healthcare professionals. In task-based learning, the student or trainee learns about the task, develops an understanding of areas related to the task, and looks at the application of the knowledge and skills in an other context and acquires generic competencies as exemplified in the task. So this seems a complicated statement, but there are few steps which we can make clear. The first is that a student or a trainee learns about the task. So that is first thing, learn about the task. Second, develops an understanding of areas related to the task. That's very important, right? Otherwise, if it is just a task, then it is like a mechanic. It's we might remember some technicians in the operation theater. They are good at doing lumbar puncture or giving local anesthesia, but they just know that task. They know only that procedure. they do not know or understand the areas related to the task. That is important concept, that it's not only learning about the task, but understanding of areas related to the task. And the third point looks at the application of knowledge and skills in another context and acquires generic competencies. So the one, learning about the task. Second, understanding of areas related to the task. Third, applying the knowledge in a different situation. And fourth, acquiring generic competencies. So we will go more in more detail, but these are the four things which make a component of a task-based learning. The reason I really want to emphasize is on the second part, developing the understanding of areas related to the task. Right, now I know everybody is tired and maybe sleepy. Just have a little bit exercise. Let us see, the task is measurement of blood pressure. And we know that the student is supposed to learn about the task. Student is supposed to learn or have understanding of areas related to the task, then application of knowledge and skills in another context, and generic competencies. So these are the four areas which student need to learn about a task, which is measurement of blood pressure. Now we have three levels of students: year 1 student, year 5 student, and house officer. So let's say we learning about the task. Task is blood pressure and learning about the task. So just think, what are the areas? For example, the second one, understanding of areas related to the task. So what are the areas related to the blood pressure measurement, which a first-year student would learn? Maybe, for example, the blood supply, maybe the location of arteries, maybe feeling the radial artery, something like that. Then what a fifth-year student is supposed to do and what is a house officer to do. So you can do this exercise sometimes later and just fill up this table, and that would help you to understand what is really task-based learning about. Problem-based learning has been recognized as an important educational strategy and has been adopted in many medical schools. In the SPICES model of educational strategies, PBL is presented as a continuum. 11 steps in the continuum between PBL and information-oriented learning have been described. Means there are 11 steps between traditional lecture and PBL, and task-based learning is viewed as the final step at the problem-based end of the spectrum. So basically, we can say that the task-based learning is the highest level of problem-based learning. So let's say as I said, in SPICES model, presented by Harden, one side is traditional lecture, other side is problem-based learning, and there are 11 steps in between. It's a continuum, but finally it ends up with task-based learning. So it means that task-based learning is a problem-based learning, but it is the highest level of problem-based learning. So that's why, rather than having a paper problem, here is the actual task, which becomes focus of learning. And as I said, 4 things to be learned about the task, areas related to the task, and then the application of learning in a different situation, and the soft skills are associated with that task. So this is what is actually a task-based learning. The base is same as problem-based learning. In task-based learning, the learning is based in the real world of clinical practice, means that it is basically in the wards. For clinical students, they learn really in the real world, in clinical
Sir,
practice.
excuse me. Sir, task based learning simulated setting में भी तो हो सकती है ना, real world के अलावा?
Yes.
Simulate, yes. लेकिन इफेक्टिव ये होगी कि अगर आप रियल वर्ल्ड में करें, वरना सिमुलेट, yes, of course, आप एक person, you can have a simulated patient and then ask the students to take the blood pressure, for example, measuring blood pressure. So it can be there, especially in preclinical years. Lekin if it is in the clinical years, it's better to do it in the real situation. Then of course you are right, it is possible in simulated environment as well.
Yes, sir.
All right. So as task-based learning is considered the 11th and final step in the PBL continuum, all the principles described for PBL, which is focusing the learning on a problem, building new knowledge on what the students already knows, active learning, and a student-centered approach to learning apply to task-based learning as in PBL. So all the principles, all the basics of PBL also apply to the task-based learning, which is focusing on learning from a problem, building new knowledge, active learning, and student-centered. Right? So basically, we can say that this is another form of problem-based learning, but better than traditional problem-based learning. In task-based learning, students perform tasks which healthcare professionals are commonly faced in real life. That's important. They choose the tasks which are common, not the rare things. When experiences are reflected upon, students understand that the knowledge and skills acquired can be generalized and applied in another context. Reflection is a very, very important part of task-based learning. When you perform a task, you learn about it, you learn about the areas related to the task, and then you reflect upon that. A reflection is a major portion of, or major component of a task-based learning, to think about all the experience, what the student have gone through that.
सर ड्रिल्स भी टास्क बेस्ड लर्निंग में आती हैं, जैसे आप इमरजेंसी ड्रिल्स कराते हैं, पीपीएच ड्रिल है, पोस्ट ग्रेजुएट्स को जैसे करा रहे हैं, या शोल्डर डिस्टोशिया कोई ड्रिल करा रहे हैं, वो टास्क बेस्ड लर्निंग में आएगी?
एज लॉन्ग एज अगर उसमें वो 4 लर्निंग पॉइंट्स आते हैं, ठीक है, वो टास्क भी सीखते हैं और उससे रिलेटेड एरियाज भी करते हैं. Yes, that would be task-based learning. That's why I was emphasizing कि उसके 4 components जरूरी हैं to be labeled as a task-based learning. Otherwise तो वो एक technician वाली बात है ना, कि आपने एक procedure सीख लिया. So
नहीं सर, जैसे हम कहते हैं पोस्टमार्टम हेमरेज हो गया, इस पे हम ड्रिल कराते हैं, ठीक है, नर्सिंग के स्टूडेंट्स भी हैं, मेडिकल स्टूडेंट्स भी हैं, हाउस ऑफिसर्स भी हैं, ट्रेनी भी है, तो वो तो एक पूरी हेमरेज की ड्रिल है, इमरजेंसी में करना क्या है, तो वो टास्क पे
हाँ, वो उसमें आएगा, क्योंकि वो उससे रिलेटेड एरियाज भी सीख रहे हैं. Yeah, right. Okay. So here the what we call is the Kolb's cycle. The task-based learning is in accordance with the theory of experiential learning. Yeah, this may there is a concrete experience or peer reflection has experience, but that's why I was saying that the reflection is an important component. इसमें or then is the abstract conceptualization, means वो चीज जो हमने उस task में सीखी है, where else we can apply, or then we apply in that situation and we learn from there. So this is what is the experiential learning cycle, which makes the basis of task-based learning. Right. Task-based learning emphasizes the importance of reflection as an activity linking experience with learning. Now, here is a study which I'm quoting. This appeared in Medical Teacher in quite old 2001, and the following statements are actually the conclusion of that study. The first, the success in task-based learning was based on the motivation and learning needs of the students. So because, as I said, it is a form of PBL, so students have to identify the learning needs in the first group at the onset, or motivation or learning needs are the real things which make the task-based learning as successful. The students were given something real to do. They had an opportunity to be active and not simply to watch others work. So this is a second reason why task-based learning is more popular and among the students and helps in learning. So first is the motivation and learning needs. Second is the something real to do, hands-on kind of activity, and giving students an opportunity to apply skills in real life, not in a simulated situation, is apparently one reason for their positive statement. I mean, that's what I was saying, that although we can do it in simulated environment, but doing in real environment makes it more appealing for the students. Here is a comparison between PBL, and this PBL is task-based learning. It's not team-based learning. So the problem usually a written simulation or scenario, whereas in task-based learning, an example in clinical practice of the work undertaken by health care professional. Learning outcomes in PBL, they are implicit. They are not given to the students. Students have to identify their learning needs themselves. Whereas in task-based learning, they are made more explicit, and students are informed that what is expected of them when they go through this task. Learning contexts in PBL, the sessions are scheduled in the timetable, whereas task-based learning may be more in the wards, in outpatient or in laboratories, where it is experiential learning. Fourth, PBL usually in groups, occasionally maybe individual, otherwise students usually go and learn their learning needs in groups. TBL mostly can be on individual, but of course can happen in groups as well. PBL is more suitable for early years, like we say in preclinical years, whereas the task-based learning is more suitable for later years or clinical years. If we have multi-professional or interprofessional education, then task-based learning is more easy to implement as compared to problem-based learning. So this is the comparison between the task-based learning and the problem-based learning, although task-based learning is the highest form of problem-based learning, and same principles apply to both of them. Right, examples of tasks and the learning outcomes. Let's say that here the task is take a history from and examine a patient with fractured arm. So the objectives or learning outcomes for first-year students can be knowledge about the bones of the arm and the structure of the bone, communication skills, and an awareness of health care facilities in the hospital. And basically learning about the healing and the bone metabolism. So it's the same task, but the learning outcome or objective of for first-year students is mainly related to basic sciences. The same task, when it's being used for senior students, the learning outcomes or objectives may be different. Like here, causes and management of fractures, including the pathological causes and control of pain. If the same task is given to a house officer, the learning outcomes becomes even more different. For example, X-ray interpretation and practical procedures such as splinting, and an increased appreciation of how illness reduces the ability to work. So basically what I'm trying to demonstrate here is that we have a task. The same task can be used at different levels, but of course the learning outcomes would be different. Right? Another example, talk to and examine a patient with myocardial infarction. So, and the learning outcomes for a first-year student: describe the normal structure and function of the heart, explain the measures for coronary disease prevention, demonstrate the communication skills in a simulated environment. So if you see, it's exactly looks like problem-based learning, where you identify the learning needs. Learning outcomes for a fifth-year student might be: explain the rationale for biochemical ECG and other investigations, describe the pathology of atheroma, or explain the management of pain in cardiogenic shock. And if it is for a house officer, perform procedures such as cardiopulmonary resuscitation and electrocardiography competently and independently, right? So this is, again, a task, a procedure which is commonly, or situation commonly faced by healthcare professionals, but the learning outcomes would be different at different stages of the training. Right, now here is a task. A 7-year-old boy is suspected to have acute appendicitis. Write a referral letter to the pediatric surgeon for further management of this patient. And then you can think about the learning outcomes for a fifth-year student. So if the student is supposed to write a referral letter to a pediatric surgeon about a patient suspected of acute appendicitis, so what information that student need to collect, and what information based on the history, on the physical examination, on the investigation, student would write in the referral letter. So here the task is writing a referral letter about that situation. So again, you can sit and think about what could be the possible learning outcomes from this task. So this is another example of a task-based learning. Right, so implementation of task-based learning. There are 8 aspects of implementing task-based learning. The first, determination of course learning outcomes. Second, specification of the tasks. Third, preparation of a grid, starting learning outcomes for each task. Appraisal of the options for introducing task-based learning in the curriculum. Provision of learning opportunities. Determination of the role of staff in task-based learning. Development of study guides and organization of the student assessment. So these are the 8 steps. I will explain some of them in the coming slides. specification of the tasks. Of course, the task, the student or trainee should have an access to the task. We cannot propose a task where students do not have access to that. It is pointless to select a task the student is unlikely to encounter and to which he or she cannot relate. Example like special procedures, where those things would not be applicable in undergraduate students. A task should provide a focus around which the student or trainee acquires the specific knowledge, skills, and attitudes in the areas of study. Now, the areas of study can be any discipline, community medicine or pediatrics or internal medicine. So in that area, the specific knowledge and skills in that particular area related to the task, a basic understanding of the topic, including the basic medical sciences, and third, generic or transferable skills, for example, communication skills or management skills. So one, the task should be easily accessible to the student. Second, task should provide a focus. So it should be stimulating enough for students to learn about the specific knowledge, about the basic medical sciences, as well as the generic or transferable skills. It is important in implementing task-based learning to consider the context, whether we are talking about a hospital ward, or we are talking about hospital outpatient department, or in the community, or in the practical laboratory, or in clinical skill labs under simulated conditions. So it's important to decide about the context, because the learning outcomes would differ in different situations. What is the criteria for selection of a task? The task deals with common problems in the community. That's important. The task is appropriate focus for learning clinical medicine. The task provides the required knowledge, skills, and attitude based on the course learning outcomes, means whatever learning outcomes of that course or that posting, the task should be related to that. Otherwise, the students would not be really interested, because it does not relate to the learning outcomes of the course. And the task provides integration of clinical and preclinical subjects. Use grids to match learning issues with tasks. In planning a course and preparing a coherent learning plan, it's often helpful to prepare a grid. I'll show you an example. These are very, very useful, because these grids can give you a lot of information in just one glance. The grid makes clear how the task will meet the course learning outcomes. However, we know that some objectives or learning outcomes may be addressed through more than one task. Here is an example. These are the course learning outcomes, and here are the tasks, and this is how they match this. For example, the one course learning outcome is communicate effectively with patients and their family members, right? And then if the task is management of a child with acute gastroenteritis, of course, this communication would be exhibited through history taking, explanation of the clinical condition, explanation of suggested treatment plan, explanation of preventive aspects, and explanation of recognized complications. So these are the areas where the communication skills may be demonstrated, and this can be done in a task like management of child with acute gastroenteritis. On the other hand, if the learning outcomes are related to the procedures, for example, perform common procedures competently. And here we have given the example of a collection of the blood specimen. If I can reduce the size a bit. No. Here. Yeah, here. So here you can see that the learning outcomes of related to communication are very well addressed in the task like management of child with acute gastroenteritis, whereas with procedure is very well addressed in the task of collection of blood for culture sensitivity. So basically, having such grids where we have the course learning outcomes and the task and matching that which course learning outcomes are being met clearly with which task helps in just one glance to explain the whole curriculum. So such grids would be really, really useful if we want to implement the task-based learning, right? Okay, now the next point, design a reliable and valid student assessment process. So what are the appropriate assessment processes or assessment methods which can be used in task-based learning? First, of course, any new approach to teaching and learning, assessment is critical, and same thing applies to task-based learning. The assessment process should reflect the objectives and content of the curriculum and the higher level objectives rather than only factual recall, and the students' application of theory to practice should be addressed. So aim is higher level objectives, which is more than simply recall, and actually is the application of knowledge, which is the main aim of assessment. And the best method are the performance-based assessment. For example, OSCE would be the best method of assessment of task-based learning sessions. Right now, how to conduct a task-based learning session? We can divide it into three parts: pre-task, during the task, and after the task. In pre-task, of course, the lecturer has to set the task and contextualize the topic, means inform the student how this task is related to their course or their curriculum. Has to raise the student interest and prepare learners to perform the task. So there needs to be a small session between the lecturer and the students, and where lecturers tell them about the task and the importance of the task, and tries to raise the students' interest and prepares them for the task. The teachers might need to help students with both content and scope. Teachers need to inform the students what kind of activity they need to perform and what kind of things they should anticipate when they are performing that type of activity, and what kind of resources they would need. And it is extremely important that students understand the objectives or learning outcomes of the task during that phase. Whereas in problem-based learning, that's not informed to the students, but in task-based learning, they are clearly informed about the expected learning outcomes. During the task, the brainstorming session among the students. same like in problem-based learning, identifying the learning needs and the resources required, exactly like PBL. Students work on the learning needs individually or in pairs, again, similar to problem-based learning. Students are supposed to perform the task in small groups or pairs and use their existing and newly acquired knowledge to perform the task. So this means that task-based learning may need more than one session. And when students finish performing the task, that's the important component here, which I was saying, the reflection. When students finish performing the task, they need to plan how they are going to report it to the rest of the class or the other members of their group. So they need to think about it, reflect upon it, and what they have learned from this task and how they are going to apply this knowledge in other activities, and what are the areas related to this task they have learned. So all these things they need to reflect and then report. And after the task, the post-task stage is when students evaluate their performance. And this might be done by comparing the outcomes of their task to the other groups or other members of the same group. And it can also involve feedback provided by the teacher and the subsequent practice of performing the task. For example, think about a group of 8 students and they are going to perform the task. So students divide themselves into 4 groups. So every 2 students perform their task, and when they come back, all the 8 students, then they present their findings and discuss with each other and the reflection. So that's how the post-task session would happen. Written reflection by the students included in their portfolio is a very important step of completing the task, because that is the real learning from the task. The advantages of task-based learning: the coaching role of trainers, strengthen trainer-student relationship. So if the relationship between the student and the teachers, they become better, and the learning environment is improved. Student performance is closely monitored and evaluated by the trainers, because this is a small group and so there's a close contact. The interdisciplinary approach, if it is interprofessional, that is excellent method of implementing interprofessional education, where the students from different disciplines are coming together, from nursing, from pharmacy, from dental, and maybe from the medical students. If they are performing one task together, so it would be a very good example of interprofessional education. I showed you this similar figure before, and the task-based learning would come here as practice doing, which is thought to be 75% chance of remembering. And if they are teaching others, they are sharing their experience, then it becomes 90%. Again, so it is much better than the other methods of teaching, like lectures, reading, or audiovisual, because the power of learning is very high, and chances of retention of knowledge is really, really high. However, there are some challenges which we need to face in task-based learning. Because it's mainly done by clinicians, and sometimes they may not be able to spare time for such tasks if they are scheduled in their training, because the emergency duties or emergency cases may make it impossible. And we need to prepare the staff repeatedly, conducting workshops to help the staff to understand the principles and implementation methods of task-based learning. So staff training is really, really important. And the examination, which is OSCE and for example, multiple choice questions, they need to cover these tasks. So student must know that these tasks would be examined, and they should be the part of OSCE, so that helps students to learn more about it.
सर, आपने स्टडी गाइड का जिक्र किया था टास्क बेस्ड लर्निंग में. अभी आपने कहा ना कि क्लिनिशियंस ऐसे बिजी होते हैं और इस तरह, तो ऐसा है कि आप टास्क अगर आपने पूरा स्ट्रक्चर करके आउटकम सारा कुछ लिख दिया है, तो स्टूडेंट्स उसको खुद लर्न करें और आप बाद में असेस कर ले, आप उनसे वीडियोस शेयर कर ले, अगर आप टाइम कॉन्स्ट्रेंट हैं या
वीडियो इज अ गुड आइडिया. अदरवाइज टास्क बेस्ड का जो ड्यूरिंग द टास्क सेशन है वो अंडर सुपरविजन होना चाहिए
जी,
कि वो जो भी, क्योंकि वहीं फिर वो स्कैफोल्डिंग का कॉन्सेप्ट आ जाता है कि जहां स्टूडेंट स्टक हो गए, द फैसिलिटेटर वुड हेल्प. लेकिन अगर ये पॉसिबल नहीं है तो वीडियो इज जो है अल्टरनेट है कि स्टूडेंट्स वीडियो ले लें, लेकिन फिर एक सेशन में जो लेक्चरर है और स्टूडेंट्स हैं वो इकट्ठे हों और वीडियो हो और उस पर डिस्कशन करें. सो दैट इज एन अल्टरनेट मेथड, बट द आइडियल वुड बी if it is live, क्योंकि the lecturer can give immediate help or feedback. So take home message: task-based learning supports the notion that learning in medicine can occur most effectively when related to the task undertaken by the health care profession. In undergraduate education, task-based learning facilitate vertical integration because it would bring both basic sciences and the clinical sciences together. It introduces relevance and application of theory to practice and provides a strategy for continuing a study of the basic sciences in the later years. So जिस तरह task-based learning अगर preclinical years में है, so they would have some input of clinical knowledge. लेकिन अगर ये clinical years में है, so it would bring back the basic sciences. So students would be in touch with the basic sciences even in clinical years. In postgraduate education, task-based learning enhances the value of on-the-job learning because it is in the hospital, in the wards. And in continuing education, or CME, task-based learning can assist the doctor to build repertoires of skills, knowledge, and understanding. So it is useful in undergraduate, even in preclinical, clinical, and in postgraduate and continuous medical education. With that, I thank you for your attention. The only thing I want to share now is actually comparison of all the four methods which we have just discussed. The comparison in just sort of in a glance, right? I think I need to shorten this a bit. All right, now the PBL, the team-based learning, the task-based learning, and the case-based learning, and then the preparation of session, conduct of the session, and also post-conduct and stages of training. So this table summarizes the whole thing which we have covered so far, and I have already compared the PBL with the TBL now, and we have this task-based learning and case-based learning. I think I will pass this document